Hello viewers, I'm Dr. Huck. I'm an endocrinologist. I manage diabetes. I also manage other endocrine diseases such as thyroid problems, pituitary problems, or adrenal problems. I believe diabetes, more than any other disease, is such that if the patients are motivated, educated, and involved, it makes a big difference and they can manage diabetes without complications. With that spirit, I'm going to discuss today diabetes neuropathy, the most common and perhaps the most feared complication of diabetes. I hope this information will be useful to you and help you or your loved ones with diabetes better manage diabetes and prevent these complications. So what is diabetic neuropathy? As the name indicates, neuropathy means nerve disorder or nerve disease, and diabetic neuropathy means nerve damage as a result of diabetes. So our nervous system is divided into central nervous system, which consists of brain and spinal cord, and peripheral nervous system, which consists of nerves that connect the central nervous system to our body. Neuropathy generally refers to nerve damage involving the peripheral nerves.
In order to understand neuropathy, let's first look at a single nerve cell called neuron. This is what a typical neuron looks like. It has a body which is called soma, and from that extends axon, which is a long nerve fiber that conducts electrical impulses away from the soma towards our body. And it also has these tree-like extensions which receive signals from other neurons, and these are called dendrites. The axons are wrapped in a layer of fatty material called myelin in some of the neurons. Myelin helps speed up transmission of impulses along the length of axon. But not all nerve cells have myelin. The neurons are of different sizes and length, and some of the longest one extends from our spinal cord all the way down to our feet. The ones that are the longest are generally more prone to damage from diabetes. The peripheral nerves can be classified into sensory nerves. These nerves have cells that carry signals from our body back to the spinal cord and to our brain, so brain can process. Basically, these nerves help us feel touch, pain, temperature, and other sensations. Motor neurons are the other kind of peripheral nerves, and they help send command signals from our brain to our muscles and help control movement. Most peripheral nerves are actually a combination of both motor and sensory nerves, and the signals are carried in both directions. And then autonomic nerves help control involuntary but important functions of our body, such as control of heartbeat, heart rate, blood pressure, digestion, and sweating. Diabetic neuropathy can involve any of these nerves, and most of the time multiple nerves are involved. So it is called polyneuropathy, poly meaning multiple or many. Less commonly, diabetes can affect single nerves, in which case it would be called mononeuropathy, such as carpal tunnel syndrome, and a rare form of diabetic neuropathy, which is quite dramatic, and it's called amyotrophy. It involves usually hip and thighs, severe pain, weakness, and weight loss in this one. But for all practical purposes, the most common one that you see is called the distal sensorimotor polyneuropathy, and sometimes it is also referred to as diabetic neuropathy. Many patients who have diabetic polyneuropathy also have some degree of autonomic neuropathy. So why does diabetic neuropathy occurs? And if you have diabetes, are you at risk? The answer is yes if you have one of these features. And if you have multiple features, you're more likely to get it. If you have had diabetes for a long period of time, particularly more than 10 or 15 years, you are more likely to have some degree of neuropathy. And it's more likely if your diabetes has not been well controlled and your sugars have been high. But not everybody with high sugars develop neuropathy, and we think that there are some genetic markers which make a person more susceptible to getting neuropathy. We've seen neuropathy in some patients who have mild diabetes or even pre-diabetes, but statistically, if your diabetes is not well controlled, you are more likely to get it over time. There are other risk factors. If you're overweight, you are more likely to get diabetes. If you smoke or drink alcohol, you are more likely to have neuropathy. And then finally, atherosclerosis or hardening of the arteries, which can lead to heart attacks or strokes. If you have that, you are also more likely to have neuropathy. Importantly, if you have neuropathy, you are at risk of atherosclerosis and heart disease. So when our patients with neuropathy come to visit us, we carefully screen them for heart disease as well. So how does this damage occur? Um, Like any other cell or organ in our body, a nerve cell also requires nourishment, including glucose and oxygen. Actually, the nerve cells require more because of constant transmission of impulses. That takes a lot of energy, and therefore, the nerve cells are very susceptible to damage if they don't get this nourishment. It's believed that persistently high glucose through complex changes in metabolism affect the lining of the blood cells in such a way that they become narrow. This narrowing can cause damage to the nerves. Also, if your diabetes is not well controlled and your sugars are persistently high, there are changes in the protein of cells, including nerve cells, and that can cause these proteins to malfunction, not function well. And that itself can cause direct toxicity to the nerves and damage. Although the neuropathy or nerve damage from diabetes can be of different type, when people refer to diabetic neuropathy, usually they are referring to distal sensorimotor polyneuropathy, which is the commonest neuropathy patients with diabetes develop. Uh, as the name indicates, it starts distally, typically in the toes, which are farthest from our central nervous system, and with time it travels more towards the center. Diabetic polyneuropathy is quite common. If you have type 2 diabetes, there's a 50% chance that you already have some neuropathy. Actually, if you're diagnosed with type 2 diabetes, there's at least a 10% chance that you already have neuropathy. Most of the patients at this stage may not have any symptoms or have mild symptoms and may not know about it. Therefore, it's very important that you see your doctor regularly and have a regular foot exam so that this problem can be detected early and potentially get reversed. As I mentioned, this is a sensory motor polyneuropathy, which means both sensory and motor nerves are involved, but sensory symptoms or sensory involvement occurs first. And the common symptoms that the patients may describe and that you should look for are numbness in your toes and feet or tingling sensation, along with the decreased sensitivity to touch, uh, loss of temperature sensation, or loss of position sense. Sometimes actually the legs and feet become more sensitive to touch, so even a bed sheet may feel very tender in these patients. The problem with all this is that you, as a patient, may not be aware of small cuts or hot temperature if you are in a shower, and superficial injuries may go undetected. That delay, along with the reduced immune function and reduced blood flow that can be seen in patients with uncontrolled diabetes, can lead to severe infections and tissue damage. So we as doctors are more worried about the consequence of lack of sensation. For patients, actually, pain associated with neuropathy can be the most severe problem. The pain is generally felt in both sides. It starts distally, as I mentioned before, typically in the toes, and then gradually it can involve the feet, legs, and then your fingers and wrists and arms as well. The pain can be different in different patients. So you may feel a burning sensation or a piercing deep pain, or you may feel like a tight squeeze. Most of the time worse at night. Sometimes it feels like an electric current. And often patients would describe pins and needles type sensation in their feet. So in distal sensorimotor polyneuropathy, the damage to motor nerves occur a little later. And it typically involves initially the small muscles of the hand and feet. Now, these muscles may be small and the damage may be subtle, but it can lead to imbalance in the architecture and geometry of your feet and hands. And the changes can make you more prone to formation of calluses and eventually ulcers. Because you are not able to feel pain um, or the abdominal pressure point, this can go unnoticed for a while. And because these patients often have problems with microcirculation and sweating related to autonomic neuropathy, uh, the problem gets compounded. Earlier, I mentioned that regular examination is important to detect diabetic neuropathy early. Um, how do the doctors detect it? Well, a simple test that your doctor should perform at least once a year is what's called a monofilament test, which is shown here. Basically, a thin nylon filament is gently pressed against the bottom of your feet. There are certain points that need to be tested. If you don't feel that, it means you are at risk for diabetic ulcers. In some cases, when the symptoms are confusing, your doctor may order a test called nerve conduction test, which measures how fast an electric pulse moves through your nerve. Um, there are other tests that your doctors may order depending on the circumstances and symptoms. So as I mentioned earlier, diabetic neuropathy can lead to serious consequences, and these may include amputation of toes, feet or leg, and even life-threatening infections or death if not treated in time. This is a picture of calluses. Calluses occur more frequently in patients with diabetes. Muscle weakness and imbalance from diabetic neuropathy causes abnormal pressure points at the metatarsal heads or sides of the toes. Because patients have sensitive polyneuropathy, they don't feel that, and it prevents the patient from correcting their stance. And because abnormalities in sweating and blood flow is often present because of autonomic neuropathy, uh, calluses form easily in these patients. The problem with calluses are not only are they painful sometimes, they are also a starting point, and if not handled, may lead to development of foot ulcers, infections, and deformities. So for my patients who have diabetic neuropathy or calluses, I ask them to see a podiatrist and ask them to refrain from self-treatment. And if you have symptoms like that, you should do the same. The podiatrist is qualified to treat these calluses and help you design footwear to prevent more calluses from developing. And they can also help educate you how to take better care of your feet. Also, help you get diabetic shoes or custom orthotics that are designed to mitigate some of these factors and prevent calluses from occurring. The same mechanisms underlying toe and forefoot abnormalities, such as hammer toe or claw toe, that is shown in this diagram. And of course, the feared consequence is the development of diabetic foot ulcers or infections. The common site where this occurs correspond to where calluses occur. In fact, many of the ulcers originate from underlying calluses. Oftentimes, because of sensory neuropathy, the patient may not recognize this until they are infected and in bad shape, and sometimes they're so bad that they can't be treated with antibiotics and may require amputation. So if you have diabetes and if you have foot ulcer, you should see a doctor to get checked. If you have significant diabetic neuropathy, you are prone to or at risk for developing something called Charcot foot, which is shown here. This abnormal foot shape occurs because of painless collapse of the medial arch of your foot. Basically, there's downward movement of the ankle bones. The foot loses its arch and develops what is called a rocker bottom foot deformity because of a collapse of the medial foot arch. The change in shape makes the foot more likely to develop pressure points and then ulcers and infections.
That brings us to the conclusion of this video. We hope you found the information useful, and we invite you to watch the second part of this video, which deals with the prevention and management of diabetic neuropathy. Thank you and goodbye.
This video is for informational purpose only and is not intended to serve as a substitute for consultation and medical treatment. Please contact your healthcare provider about any questions pertaining to your specific condition. They would be able to provide you with answers and recommendations that are specific and accurate for you. Good luck and thank you.